The study to be presented is entitled The Effect of Early Ambulation After Transfemoral Cardiac Catheterization in Hong Kong, a single-blinded randomized controlled trial. Coronary artery disease is the second leading cause of death in Hong Kong, wherein 6,630 deaths were related to this disease, and continuous growth in these numbers can be expected due to the aging population, dietary influences from Western countries, as well as stress from fast-paced city lives. Cardiac catheterization is a medical procedure wherein a long, thin, flexible tube is put into a blood vessel and threaded to the heart, and it is used to diagnose and treat some heart conditions. It is the most definitive procedure in diagnosing and evaluating coronary artery diseases. It is currently a routine diagnostic procedure performed in many hospitals in Hong Kong, wherein the femoral artery is the most used blood vessel due to its large diameter. The transfemoral approach includes risks of bleeding, hematoma, distal embolization, and arterial thrombosis, and to reduce these risks, manual or mechanical pressure over the puncture site and prolonged bed rest is usually done. The duration for prolonged bed rest varies from 2 to 24 hours, and patients usually complain of back pain and urinary discomfort, as well as anger and anxiety after prolonged bed rest. Early ambulation was proposed as a way to counter the effects of prolonged bed rest due to its association with low rates of vascular complications, high satisfaction, and less back pain. The research question the study aims to answer is, does early ambulation in patients who have undergone transfemoral cardiac catheterization have an effect on their back pain, puncture site pain, vascular complications, urinary discomfort, general well-being perception, and satisfaction level as compared to patients who only received routine post-procedure care of 12 to 24 hours of bed rest? The objective of the study is to investigate the effect of early ambulation after cardiac catheterization on patients' back pain, puncture site pain, vascular complications, urinary discomfort, general well-being perception, and satisfaction level. The journal used an experimental study design using a randomized controlled trial. A total of 137 participants who have undergone transfemoral cardiac catheterization, 63 of which were placed in the experimental group and 74 in the control group, were used in this study with the following inclusion criteria. The study was done in one regional hospital in Hong Kong. The participants were randomly put into groups and were given 4 hours of bed rest without being told which group they belonged to. The participants of the experimental group were asked to do 1 minute of standing at bedside and walking around their rooms for 2 minutes every hour for 3 consecutive hours, while the control group continued their bed rest. The data for puncture site bleeding was taken hourly for the first 4 hours and before and after ambulation for the experimental group, while the data for the control group was taken on the first 6 hours and at the end of the 6 hours. The data for back pain was taken after 4 hours, 8 hours, and at 8 a.m. the next morning. The data for urinary discomfort was taken 6 hours after the participants returned to their units. The data for general well-being was taken before the procedure and during discharge, and the data for patient satisfaction was taken at discharge. The results of the study shows that anxiety subscale and vitality subscale scores of both groups increased after the experiment, with the experimental group showing more significant increase than the control group. To further support these findings, here are the results for the total mean score of the general well-being. These are the results for the visual analog scale scores for back pain of the control group and for the experimental group. More participants from the experimental group reported they felt no pain or mild pain as compared to the control group, especially 8 hours after the procedure and at 8 a.m. the next morning. 1 out of 74 participants from the control group reported bleeding at the puncture site, while none of the participants from the experimental group reported any bleeding. The differences in these findings are insignificant, therefore bed rest is considered safe after the procedure without inducing vascular complications. For the urinary discomfort and difficulty of the control group and the experimental group, the data shows that the experimental group reports less discomfort and difficulty. There was no significant difference between the satisfaction level scores of the control and experimental groups. To conclude, early ambulation, especially 4 hours after cardiac catheterization, is beneficial in decreasing back pain, urinary discomfort, and in promoting general well-being of patients after cardiac catheterization. The effect of early ambulation in decreasing nursing time for patient care, decreasing length of stay in hospitals, and reducing hospital costs should also be considered in future studies. The group recommends early ambulation after cardiac catheterization but with extreme precaution. According to the study, early ambulation presented benefits to the patient such as decrease in back pain, decrease in urinary discomfort, and increase in the general well-being of the patient. Thus, addressing these problems at an earlier time would significantly hasten the functional recovery of the patient. However, we must still be cautious with this intervention given the small sample of the study and the characteristics of the participants involved. The general population included the elderlies, which means that we are still unsure regarding the effects of such intervention when given to patients in other age groups. So, since the study only took patients from one hospital, we must not be very confident that the same results will be seen for patients who received a different style of care or treatment.